You mentioned with mitral valve disease that the left atrium sometimes got enlarged. That might lead to atrial fibrillation. Is the atrium where fibrillation occurs?
That's where the action is. You know, there's a right atrium and left atrium, right ventricle, left ventricle. And the atrium are the two upper chambers. And the right atrium is the source of the electrical pathway. It's the left atrium usually where the excitable cells get going and cause atrial fibrillation.
How fast does that atrium beat?
If it can go over 200.
Wow. Will 200 beats go through?
Well, the atrial fibrillation can go like that, and how much goes through depends on the node conduction to the ventricle. But if it's 1-to-1, it'll be over 200.
So if my rate was 200, how would I feel?
You wouldn't feel very good. You'd feel short of breath, you'd feel palpitations. Yeah. It's not a comfortable feeling, and some people tell you they just flat out feel terrible.
If somebody comes to you and said, my heart was fluttering and I felt absolutely terrible, would that come to mind, atrial fibrillation?
Absolutely right, yes sir.
So if you do electrocardiogram, are they necessarily in atrial fibrillation?
Not always. Here's the way you work this up. You get a 12-lead electrocardiogram. If you find it on the EKG, you've got a diagnosis. If it's not on the EKG, you can do a 48-hour Holter to monitor the heartbeat over 48 hours. If the episodes are less frequent, you can do an event monitor, which you get to take home for 30 days and 30 nights. And anytime you have an event, you press the button and it's recorded, and then Telerhythmic sends it to us and we can diagnose it that way.
In your experience, do most people know when they're having an event, or most people don't know when they're having an event?
50% of folks will be asymptomatic. This is detected.
That's scary.
Yes, you kind of think people would be more symptomatic, but we get a lot of referrals. Someone will go to see their internal medicine consultant or family physician consultant, EKG for the annual physical, you're in atrial fibrillation, we need to address this. But 50% of people are symptomatic and either come in right away or go to the emergency room or come to us directly, and we can diagnose it that way.